And you say, well, why do we have this gap? I mean, here's the data. Here's the data on the medical side. 81% medical students. These are not students in some 6-week training program to be in the outpatient clinic answering the phone. These are students getting MDs. 4/5 of them say they don't have training. They're not going to be good providers when they leave medical school because they don't feel they're trained. They don't have classroom instruction. The deans say there's no time. 3/4 of them say, sure, they'd be happy to be part of the treatment picture, but at this point, as they leave medical school, the training isn't there. The data. We don't have surveillance data, and again, I'm going to open this up for discussion in just a minute. The cuts in Medicare and Medicaid services are draconian as they affect this population. Housing cuts, I was happy to hear Nebraska making moves to really do significant work to end waiting lists, but most states are not. Most states, the waiting lists are growing. We have a smaller percentage of people working in competitive jobs than we had even 5 years ago. And you'll see the poverty rates. This is just disability. This is not disaggregated for intellectual disability. The poverty rates for women and men with disabilities, 2, 3, 4 times the rates for people without disabilities. And you could probably multiply that 2 times for people with intellectual disabilities. So take a guess. We don't have the data again, but if you're looking at a poverty rate of 30% for women with disabilities, my guess is when you put in intellectual disability, you'd probably be in the 50 to 60% range in poverty. How do you get poor? By not being able to get a job. 22% of people with disabilities, 22% in the workforce, have it for people with intellectual disabilities. So what does that translate into? Depends on how you count the statistics. But to me, the simple statistic is if you've got 10% of the workforce, you've got 90% outside the workforce. So people say, well, that's not unemployment. Unemployment is somebody who had a job and goes and files for unemployment benefits. Well, I talked to enough people with intellectual disabilities who would like a job who have never had one. To me, they're unemployed. I don't know what you want to call it, but they're not employed. So we're talking about an unemployment rate by my definition, not by the Bureau of Labor Statistics, but by my definition of something like 90%. So here's where I really hope we can spend a few minutes, and I'm probably run over time, but just a few minutes. We need a call to action. So for providers, those of you in this room, those of you who have access to people in this room, those of you able to watch us either electronically today or in the future, we need to focus on continuing education about the health disparities and health issues facing this population. We need to train people on how to interact with people with intellectual disabilities. I'll say more about that in just a second. We need to advocate for the training of adult health care providers. The pediatric system is not bad compared to the adult system, at least this is my sense, but the adult system is terribly behind. We need to invite people with intellectual disabilities into the system, not just as patients, but as advocates. Every hospital like this has commissions, has advisory groups, has supported groups, has community leadership organizations, has people that come in and help make the hospital better. I'll bet you, no offense, there's not a person with an intellectual disability on any of them. Not at this hospital or not at this medical training center, but at 90% of them. I hope I'm wrong. And I'd love someone to tell me I'm wrong. But my fear is, in medical centers across this country, we're not hearing from people with intellectual disabilities themselves. We're hearing maybe from a guy like me, but get me out of the way and allow people to speak for themselves. Yeah, so it takes them a little longer. Slow down, doctor. Maybe that's part of the message. Yes, maybe there's some challenges with understanding exactly what the message is. That's a good message. It's a challenge. We have to listen a little better. Maybe you have to take a different kind of context to facilitate the discussion. Also a good message. We've got to make these kind of accommodations if we want to fulfill the vision. Policy. Medically underserved remains a huge challenge. Our population's not designated as medically underserved. We're trying to get that, support the passage of that designation in federal policy, of course, our own Eunice Kennedy Shriver Act. But let's look at the health educators, going right back to these deans of colleges of medicine and other medical training facilities. We've got to keep advocating, pushing, demanding, challenging those people to change. They're going to tell us there's 100 reasons why you can't do it. No time, no this, too many approval. Everybody heard that before. That's the same thing that Dr. Evans's cousin was told when he was 2 years old and had to go to that state school. Sorry, nothing for you, you got to go there. So we can't take no for an answer. A lot of people are going to give us no. We're just used to it. Our own movement, for those of you that are part of the Special Olympics movement, we've got to get our coaches and our volunteers to stop saying to people, come to practice on Friday night for an hour, run around the track 3 times, do a couple jumping jacks, and I'll see you at state games. That's not fitness. That's not health. That's not high expectations. That's not challenging people to get in shape. That's not challenging people to become flexible. That's not challenging people to take their own health and their physical activity seriously, to own their bodies and their health. We've got to demand high expectations within our movement. A lot of our organizations in this field don't have high expectations for the people we supposedly serve. And finally, follow the 10 Commandments. And this is one of our, I'm going to go, well, I'll get to that in a second. Here's an example. We were able to go up to the University of Rochester a few months ago, talk to the people there, terrific pediatric center, terrific university-affiliated program, and we presented some of this data together with some data that they captured. And the university has since then said, we need a new model of collaboration with community-based organizations. Special Olympics in Rochester is one, but there are others. There are other group home operators, community support programs. They need to be brought into the University of Rochester, and their vision now is to create a wraparound response to the problem of health disparities for their community. Starting with training, continuing with rotations and clinical experience for their students, but continuing also to include people with intellectual disabilities on advisory boards, and to begin to create referral networks that aren't just to the pharmacy for medication, but to a Special Olympics program, to a group home support program, to a sports and physical training program, to all kinds of community resources that can promote health. So Rochester has said, we want to embrace this challenge of creating a model. It's obvious that we'd love to see that being done in 10 places, 20 places, every place. We'd love to see it done in Nebraska. If there are gaps, which they may not exist, of course we don't always know, but if the experts here and the clinical faculties here and the training faculties here see the opportunity to use these games as a platform to say we need to close the gaps, what a great legacy of these games it would be if that were to occur right here in Omaha. The data could be very important. The training opportunities could be very important. We can make these things, we can be a partner in this. Obviously, we're not the leadership organization in this, but we can help. We can play a little role, but we need others to step up. So here's what our athletes have done as part of the effort to create a challenge to their healthcare providers. Let's see if, cannot open the specified file. That's so disappointing. Okay, so what it is, this is kind of violates the cardinal principle of what I'm trying to say here, but it's a clip of people with intellectual disabilities giving 10 orders to their healthcare providers. The orders include things like, speak to me, not to my mother. Orders include things like, slow down, I don't understand what you're talking about. The orders include, are you racing up to tell me I can make this work? Carl? No? No, okay, I didn't want to keep trying. But the point here is that the medical system needs to see, as these athletes, as these people with intellectual disabilities are saying, needs to see these people as full human beings, as patients, as people capable of living full lives, not people that they're trying to fix. In the end of the day, most doctors, for obvious and good reasons, come at a patient thinking, let's fix. Our people are saying, I need to be cared for, I need treatment, but I don't want you to fix me. I want you to listen to me, I want you to include me, and I want you to care for me, but not fix me. And if we can get that fixed later, maybe we can watch it. So I'll go back to the call to action because I'd love input on that, but let me just close, if I can, with my greatest inspiration on this. When you say, what's the vision? Where are we headed? How do we think about this issue? This is a picture of Troy Daniels graduating from high school in Northfield, Vermont in the year 2002. And I've been spending time with this speech for 8 years now, but it still doesn't ever get old for me. And he was selected by his graduating class to be the graduation speaker. And he, unlike me, was brief, and unlike me, was also packed it all into a few sentences. So with your permission, I'm just going to read you a few sentences from his graduation speech, because I think it brings us back to Martha and Jessica, where we started, and the vision we're trying to embrace today. So he starts, "My name is Troy Daniels, but my friends call me TD." This is a graduation speech. "I have Down syndrome. Because my heart is bad, I use a wheelchair. I do not speak very good. I'm a person with disabilities, and when I say my friends, I mean friends, real friends. Just like everyone else, I want friends. Most of you think all people have friends, but for people with disabilities, friends are not always real. Not too long ago, people with disabilities could not go to school with other kids. They had to go to special schools. They could not have real friends. They called people like me retard. That breaks my heart. When I came to school, there's a law that says all kids go to school in the place where they live. I started school here in Northfield with all the senior class. We were little kids together. The law says I can come to this school, but no law can make me have friends. But then some kids started to think I was okay. First, it was just 1 or 2 kids. They found out that I cared about them and they cared about me, and I loved my school. I told them I want real friends. We started to learn together that in some ways we were different, but in some ways we were the same. They called me friend and made sure that I was included. I cared about them and they cared about me. I want all people to know and to see that these students I call my friends are the real teachers in life. They are showing you how it should be. Yes, I am a person with a disability. The law says I am included, but it is my friends who say, TD, come sit by me. I think the invitation is fairly simple. We have a population that fought discrimination, the old kind of active discrimination. They fought it, the law. They fought discriminatory attitudes where people would state openly propositions of inferiority. They fought barriers, literal physical barriers. They broke down walls. But the discrimination has shifted. It is now more subtle. It is discrimination of attitudes. It is a discrimination of passive behaviors, not active ones all the time. It is a discrimination that doesn't so much posit inequality as assume lesser value. Troy is just saying to all of us that the medical system, the educational system, our communities, our families, all we need to do is be sincere, authentic, and thorough in an invitation for folks to come and work and sit together. But that invitation is an invitation not yet met. So thank you all for coming, and I promised a short speech and I blew it.